Assalamu alaikum, dear all students, my dear friends. This is Mir Asif, and you are watching A&H Study Hub. So today we'll be discussing about the cardiac cycle. Last time we have discussed about the conduction system of the heart. So today we have the basic discussion about cardiac cycle. What is cardiac cycle? Cardiac cycle is the mechanical events which are occurring during each systole and diastole. The mechanical events occurring during each systole and diastole. The mechanical events occurring during each systole and diastole. What is so means the cardiac cycle is one cardiac cycle is equal to one systole plus one diastole. What is systole? Systole means contraction. Systole means contraction and the diastole means relaxation. During the contraction, it will eject blood out, and during relaxation, the ventricles will start relaxing and the ventricles will fill with the blood. Okay? So there are different mechanical events which are happening during the cardiac cycle. The first event is atrial contraction. The first event is atrial contraction. I will draw a left heart here. This is the left atrium. Yes, this is left ventricle, and this is aorta, and this is aortic valve, and this is the mitral valve. Okay, let me draw it with the different color. Left atrium, atrial contraction. Okay, means when electrical events will lead to mechanical events. When SA node fires, when the SA node will send impulses towards the atria will lead to atrial contraction. Means the electrical event will lead to mechanical event. Okay, so the first event is atrial contraction. First event is atrial contraction. When left atria, I am talking only about the left side of the heart, but the same events will happen from the right side of the heart also. Okay, but I will draw only the left side of the heart here. When the left side of the heart, when the left atria contracts, it will eject blood towards the left ventricle. At the same time, right atria contracts and it will eject blood towards the right ventricle, and it will fill the, means both the ventricles will be filled with the blood. Okay, when left atria contracts, it will fill the left ventricle. During left atrial contraction, there is already passive filling. Left ventricle is passively filling around 80%. There is passive filling into the left ventricle, means 80% of blood is filled during the left atrial contraction. This valve is closed during the left atrial contraction. When left atria contracts, means it has to fill the remaining 20% of the cavity. It has to fill the remaining 20% of the cavity. When left atria contracts, not only it will eject the volume into the left ventricle, but also the pressure will be also transferred from the left atrium into the left ventricle. The pressure normally here is 5 to 6 millimeter of mercury. The pressure into the left atrium is 5 to 6 millimeter of mercury. When left atria contracts, it will transfer the blood into the left ventricle. Also pressure will be also transferred into the left ventricle. When the pressure becomes more than the left atrium, when the pressure becomes more than the atrial pressure, it will close. Yes, which valve? It will close this valve. It will close mitral valve. Okay, So now both the valves are closed. Both the valves are closed. Now the second event is which one? Yes, the second event is, let me draw a heart here, little big. This left atrium, left ventricle, mitral valve, aortic valve, and the aorta. Okay, when the mitral valve closes, now the second event is left ventricular contraction, means both the ventricles will start contracting. That is the beginning of the contraction. Left ventricle and the right ventricle will start contracting. When left ventricle start contracting, but it will start as a closed chamber. Ventricles will start as a closed chamber because mitral valve is also closed and the aortic valve is also closed. This event will name as isovolumetric contraction. Isovolumetric contraction. Because why we'll call it as isovolumetric contraction? Because there is no volume remains the same. There is no volume change. There is no volume added from the left atrium or from the aortic valve. Means the ventricles are contracting as a closed chamber. There is no volume change and there is, so that's why we will call it as isovolumetric contraction. When left ventricle start contracting as a closed chamber, it will progressively build pressure into the left ventricle and the right ventricle. Means the ventricle will start building pressure progressively. Okay, when the pressure becomes more than the aortic valve, when the pressure becomes more than the aorta, it will eject blood into the aorta. Okay, it will open up the aortic valve and it will eject blood into aorta. Okay, so during a left ventricular contraction, initially the pressure is here 80 millimeter of mercury into the aorta. Okay, but here in the left ventricle the pressure is less than 80 millimeter of mercury. During the beginning, pressure here was 5 millimeter of mercury or 6 millimeter of mercury. When the left ventricular pressure becomes more than the aortic pressure, atrial pressure, it closes which valve? Mitral valve, so that the backward flow will be prevented. Okay, but means at the star 5 will name this stage. Okay, star 5 means when the pressure becomes, or 6, star 6 means the pressure here in the left ventricle becomes more than the atrial pressure. It closes mitral valve. Then the left ventricle will contract as a closed chamber and progressively it will build the pressure into the left ventricle and at the same time from the right side of the heart. And it will progressively build pressure around 80 millimeter of mercury. But so this is the same pressure into the aorta and into the left ventricle. So it will not lead to opening of aortic valve. Why? Because the pressure is same. But when it will keep on contracting, but when the pressure here becomes more than the aortic pressure, it will open up which valve? Yes, it will open up the aortic valve. Yes. So means when here the pressure becomes 81 millimeter of mercury, it will open up which valve? Aortic valve. Understood? So this was the isovolumetric contraction. Then the third phase is, yes, this is left atrium, mitral valve, left ventricle, aortic valve, and aorta. When the pressure becomes more than, during this phase the pressure is same, means the ventricles will contract as a closed chamber. But in this phase, when the pressure becomes more than the aortic valve, this valve is closed already. Okay, when pressure here becomes more than the aortic pressure, this valve will be opened. Understood? So what will happen? The pressure here is more than the aortic pressure. There will be, yes, this is which event? Ventricular contraction is continuing. Okay, means when the left ventricle means when the aortic valve opens, there is a rush of blood ejecting out. There will be, this phase will call as rapid ventricular ejection phase. Rapid ventricular ejection phase. Why the left ventricles will eject blood rapidly? Because the pressure here was more and here it was lesser. Understood? So that means there will be rush of blood moving towards the aorta from the left ventricle. Understood? When the blood is ejecting towards the aortic valve, it will keep on building the pressure into the aorta. The aortic pressure will build up to 120 millimeter of mercury. Initially it was 80 millimeter of mercury, but when left ventricle contracts, it will eject blood rapidly into the aorta. So there will be volume change into the aorta, and the pressure will be also transferred from left ventricle into the aorta. Understood? So here the pressure will keep on building up to 120 millimeter of mercury. But when pressure transfers from the left ventricle into the aorta, then the blood will be ejected with the less force. So that phase will call as, yes, this is left atrium, left ventricle, aorta, mitral valve, aortic valve is open. So when the pressure here reduces, blood will be ejected with less force. So this phase will call as slow ejection or slow ventricular ejection phase. Slow ventricular ejection phase. Understood? When left ventricle ejects blood slowly, here pressure is progressively increasing. Okay? When pressure here becomes more than the left ventricular pressure, it will close. This aortic blood will try to move back from the higher concentration into the lower concentration. It will close which valve? The aortic valve. From the left side of the heart and from the right side of the heart, it will close pulmonary valve. Why it will close? So that it will prevent the backflow of blood into the left ventricle. Understood? Now, we'll move to the next phase. Yes, this is left atrium, left ventricle and aorta and aortic valve. Aortic valve is closed and mitral valve was already closed. When the aortic valve closes, now the left ventricle have to relax also. Now there is a left ventricular relaxation phase. Left ventricle will start relaxing. But as a closed chamber. Why? Because mitral valve was already closed and aortic valve is already closed. Now the ventricles will start relaxing as a closed chamber. This event will call as isovolumetric relaxation phase. Isovolumetric relaxation phase means the ventricles are relaxing as a closed chamber. Understood? There is no volume change into the left ventricle. At the same time, in the right ventricle, there is no volume change. So ventricles will start relaxing as a closed chamber. When ventricles start relaxing as a closed chamber, it will not lead to opening of mitral valve. Why? Because still the left ventricular pressure is more than the atrial pressure. The pressure here in the atria is 5 to 6 millimeter of mercury, but in the left ventricle it is more than the atrial pressure. So it will not lead to opening of mitral valve. Okay? But during all these phases, left atrium is acting as a reservoir. It is receiving blood from the pulmonary system. Here, let me draw one diagram here. This is, yes, lungs, right lung, left lung, and from the each lung, 2 pulmonary veins will be drained into the left atrium. Understood? So during all these phases, the atria is acting as a reservoir. So atria is continuously receiving blood from the pulmonary system. So it is keep on receiving the blood. But when the pressure, here is no volume change into the left ventricle, but when the pressure, so and it is also keep on relaxing, so continuously or progressively its pressure will be reduced. When the pressure becomes, when the atrial pressure becomes more than the left ventricular pressure, when the atrial pressure becomes more than the left ventricular pressure, it will lead to opening of which valve? It will lead to opening of mitral valve. Okay, so let me draw it here. It will lead to opening of mitral valve. This is aortic valve. It will lead to opening of mitral valve. But when the mitral valve will open up, so it will, the blood will be rushed from atria into the ventricles. So there is, the ventricle will be filled with high pressure. Understood? So this phase we'll call as rapid ventricular filling or rapid passive. This time without the atria is ejecting blood into the left ventricle, or left ventricle is filled with the blood from the atria without any contraction. So this we'll call as rapid passive ventricular filling. Rapid passive ventricular filling. Okay, but the pressure, not only the volume it will transfer, so at the same time it will also transfer the pressure also. But here the pressure will start reducing. Here the pressure will start reducing. So it will eject blood with less force. It will eject blood with less force. Understood? So now the next phase is, this is closed. Now the next phase is slow ventricular or slow passive ventricular filling. Slow passive ventricular filling. Understood? But slow passive ventricular filling. But when the pressure here becomes more, when the pressure during the slow passive ventricular filling, the pressure here becomes less as compared to, yes, left ventricular pressure. Now the next phase is at the last atrial contraction. Left atria has to contract again. Understood? So that it will fill the remaining 20% of the blood. So there is a passive filling during a rapid passive ventricular filling and slow passive ventricular filling. During these two phases, left ventricle will be filled 80%. How much? 80%. So again, the atria will contract. Okay, then the next phase is isovolumetric contraction, and then rapid ventricular ejection phase and slow ventricular ejection phase and isovolumetric relaxation phase, during which both the valves will close. And rapid passive ventricular filling, because the pressure into the atria was more, so that it will fill the left ventricle with high force. Okay, and then slow passive ventricular filling, during which the ventricles will be filled with the blood but with less force. Understood? Because the pressure here will reduce. Now we'll correlate these cardiac cycle. This cardiac cycle will correlate with the heart sounds. This cardiac cycle will correlate with the heart sounds. Just a brief. We'll have a brief lecture here, and then we will have a detailed lecture into the upcoming videos. Okay, let me draw it with the different color show. During left atrial contraction, this is open. During left atrial contraction, valves are open. Mitral valve is open and the aortic valve is closed. During opening of valve, it will not produce any sound. It will not produce any heart sound. But when during isovolumetric contraction, means when the ventricles will start contracting, just before ventricular contraction, this valve will be closed. Which one? Mitral valve here was open, and when the pressure here becomes more, it will shut off the valves. Which one? Mitral valve. During opening of valves, it will not produce any sound, but when the valves will close, it will produce sound. Understood? Opening of valve will not produce any sound. Closure of valve will lead to, yes, heart sounds. So from the left side of the heart, mitral valve will be closed just before the isovolumetric contraction at the end of the atrial contraction. And from the right side of the heart, tricuspid valve will be closed. So both tricuspid and mitral valve will lead to, yes, which heart sound? S1 heart sound. Means first heart sound. S1 is which one? S1 heart sound is first heart sound. First heart sound. The S1 heart sound or the first heart sound is because of mitral valve, mitral closure, mitral and tricuspid closure. Okay? Then we'll move to the next phase, rapid ventricular ejection phase, during which the aortic valve will open. But during the opening of valves, I told there will be no production of heart sound. But just before, during the slow ventricular ejection phase, that time the ventricles are ejecting blood with less force, so there will be no heart sound. But at the end of the slow ventricular ejection phase, just before isovolumetric relaxation phase, when ventricles are relaxing, when the ventricles are relaxing, the aortic valve is closed. But just before the isovolumetric relaxation phase, this aortic valve will be closed. During the closure of the valve, it will lead to production of which heart sound? Yes, second heart sound here, S2 heart sound. Means the S2 heart sound is produced because of S2 heart sound is produced, S2 heart sound, or the second heart sound is produced because of closure of aortic valve and closure of pulmonary valve. Closure of aortic valve and closure of pulmonary valve. Okay? During the rapid passive ventricular filling, it will lead to, but that is normal in some patients. In athletes, when the left ventricle will be filled with the blood very rapidly. So that time it will produce which heart sound? Yes, it will produce third heart sound, means S3. But S3 is not normal in all the patients. There are some exceptions. Okay? But I have forgot. This slow passive ventricular filling phase is also called a diastasis. Slow passive ventricular filling is also called a diastasis. Why? Because this time the atria is not behaving as a reservoir. Whatever the blood atria is receiving from the pulmonary system, that is directly being added to the left ventricle here, because the mitral valve is open. Okay, so the ventricles are just, the atria is just the pathway here. So blood from the pulmonary system is directly being added into the left ventricle. So that's why this phase is called a diastasis phase. Okay. Now we have correlated the cardiac cycle with the heart sounds. Now we will correlate this cardiac cycle with pressure waves. During all these cardiac events, what and all pressure waves are produced. Okay. So I will just rub it here. I hope this is clear to everybody. Okay, so there are three waves which are produced during the cardiac cycle. One is C wave. During atrial contraction, when the left atria contracts, it will produce which wave? A wave. It will produce A wave here. It will produce A wave. Okay. So A wave is a pressure wave during left atrial and right atrial contraction. But when during the isovolumetric contraction, when the left ventricles or both the ventricles will start contracting, okay, when the both ventricles will start contracting, it will try to eject a backflow of blood. It will try to backflow of blood into the left atrium. So that time, during the high pressure into the left ventricle and the right ventricle, this valve will be everted backwards. This valve will be everted backwards, but this will be prevented by the closure of valves. So during the left ventricular and right ventricular contraction with high force means, so what will happen? These valves will be everted back into the left atrium. So the jerk, the pressure wave will be produced here. So this is the little jerk. Little jerk is because of the eversion of the valves into the left atrium. So this wave is called a C wave. This is called a C wave. Okay, so the pressure here will increase when the left mitral valve will bend towards the atria. Okay, so that time which wave will be produced? C wave. Okay, now the mitral valve is closed here, and mitral valve is closed in this phase also, and in this phase also mitral valve is closed. In this phase also mitral valve is closed. Okay, so during all these phases, left atria is receiving blood from the pulmonary system. Okay, so that means the pressure is progressively increasing into the left atrium. Understood? So it will produce which wave? V wave. So the pressure here will progressively increasing. Pressure here is progressively increasing. So that wave is called V wave. When the pressure into the atria is progressively increasing, so that wave is called a V wave. So A wave is atrial contraction wave, V wave, C wave is during the isovolumetric contraction. Okay, so V wave is the atrial wave when the pressure is progressively increasing. Okay, so I hope it is clear to everybody. Now I will rub this. So normally cardiac cycle during in a normal adult person, when the heart rate is around 72 beats per minute, or the normal average heart rate is 72 beats per minute, or the normal range is around 60 to 100 beats per minute. Okay, during the average heartbeat 72 beats per minute, the cardiac cycle is around normally 0.8 seconds. Okay, cardiac cycle is normally equal to 0.8 seconds. So each cardiac cycle will last for 0.8 seconds, but that is both, including both systole and diastole. Cardiac cycle is systole as well as diastole. So both systole and diastole will last for 0.8 seconds. Understood? So first we will discuss about atrial systole, atrial diastole, ventricular systole, ventricular diastole. Okay, so atrial systole is the first event. Okay, so 0.8 seconds. Out of 0.8 seconds, atrial systole will last for 0.1 second. 0.1 second. Okay, and atrial diastole, when the atrias are relaxing, or when the atria are receiving the blood from the pulmonary system. During this phase atria is receiving, during this phase also atria is receiving, during this phase atria is also receiving, during this phase also atria is receiving. So the atrial diastole will last for 0.7 seconds. So this is the largest event, or the during in atrial systole and atrial diastole. Atrial systole will last for 0.1 second and atrial diastole will last for 0.7 seconds. So this is the longest event in cardiac cycle. Okay. Then ventricular systole. Here during the isovolumetric contraction, left ventricle will contract. Rapid ventricular ejection phase, left ventricle will contract. During the slow ventricular ejection phase, left ventricle will contract. Okay, so but during all these phases, left ventricle will relax. Okay, so ventricular systole is around 0.3 seconds. 0.3 seconds. Which one? Left ventricular contraction as well as right ventricular contraction. So ventricular systole will last for 0.3 seconds. Okay. Then ventricular diastole will last for out of 8 0.5 seconds. Okay. So diastole phase is a longest phase in the entire cardiac cycle. Okay, so I hope today's lecture is clear to everybody. If you'll have any questions, you can drop the comments in your comment section box, so I will answer there. Okay, so we'll meet in the next lecture. Till that, Allah Hafiz.